Zerbinati. I'm a dermatologist. I work in the University of Varese, close to Milan. And I started to work with Quanta System 20 years ago. And in the past 3 years, I was involved in the development of this new technology, of the Picosecond technology. It's a fantastic world. We are changing the approach of the laser world. We are shifting from photothermal to photomechanical damage. You know that every time you use a laser, you have an absorption of the laser ray, of the laser light, from a target, and the increase of the temperature is able to destroy the target. In this case, we are speaking about photothermal damage. With Pico technology, we are shifting to the photomechanical. In this case, there is a sound wave that is able to increase the pressure inside of the target and is able to crash the target in absolutely cold mode. Just a few words about our target. If you consider the melanocytes, the dimension of melanocyte is 7 microns, so 7,000 nanometers. If you consider melanosome, we are speaking about 1.45 micrometer, so 1,450 nanometer. If you consider melanin, we are speaking about 100 nanometer. For pigment, for ink, the dimensions are less. For black pigment, we are speaking about 50, 60 nanometer, okay? Why this is important? Because today we know that with this technology, we are able to increase inside of very small particular size. You can see here, particular size of 40, 60, 80 nanometers, so exactly inside of the dimension of the melanin, exactly inside of the dimension of the black ink, we are able to induce 2,000 bar of pressure working with very low fluence. And this is possible because with the actual technology, with the Pico technology, we are working with 450 picosecond, very short pulse duration. So, this is important. If you compare all the Pico technology actually in the market, you can see that only 2 technologies are able to work with 450 picosecond. So with so short pulse duration. Only only Picowave and Discovery Pico works with 450 picosecond. Also, other laser works in picosecond, but in longer picosecond, 750, 750, 650. So they are working in sub-nanosecond. 1,000 picosecond is 1 nanosecond. So, but if you compare the power of the Picowave, the only laser that works with the similar pulse duration, if you compare the power, the maximum peak power, you can see that Discovery Pico works with the double of power, 1.8 gigawatt respect 0.8 gigawatt. And this is very important. Don't believe in lie that will tell you that so high quantity of power is dangerous. Why? Because only if you have a lot of power, you can win the challenge to remove the pigment inside of the skin. And I will explain you. Check this movie.
No, this sucker's electrical. But I need a nuclear reaction to generate the 1.21 gigawatts of electricity.
What did I just say?
The flux capacitor stores... This sucker's electrical. But I need a nuclear reaction to generate the 1.21 gigawatts of electricity.
1.21 gigawatts! 1.21 gigawatts! Great Scott! What the hell is a gigawatt?
How could I have been so careless? 1.21 gigawatts!
Tom, how am I going to generate that kind of power? It can't be done, can it?
Back to the future, 25 years ago, speak about 1.20 gigawatt. It was crazy, it's impossible. Today is the true story. Inside of this machine, you have 1.8 gigawatt. And it's not dangerous, it's not dangerous. If you compare in another metrical scale the watt, and you compare 1 watt with a needle of mesotherapy, or mesotherapy needle, this is megawatt, Bujairaraba, and this is gigawatt, Everest. Inside of this machine, you have an Everest of energy, okay? And why is not dangerous an Everest of energy? Follow me. Because I told you that Joule is the fluence, okay? And fluence is obtained watt for time, divide square centimeter. This is a rule, a physical rule. So every time you increase the time, you are able to increase the fluence. Every time you increase the watt, you are able to increase the fluence. But every time you increase the spot dimension, you decrease the fluence. Clear the concept? And why is important work with large spot size? Because only working with big spot size you can have enough penetration. So if you want to arrive deep in the dermis layer, where sometimes you have autologous pigment and sometimes and every time you have heterologous pigment, the ink of the tattoo, you must work with large spot size. Again, every time you increase the time, you increase the fluence. Every time you increase the watt, you increase the fluence. Every time you increase the spot size, you decrease a lot the fluence. So if to obtain the best clinical result, I must work with very short pulse duration. I show you that working with short pulse duration, you are able to increase the pressure inside of small molecular cells, blah, 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 blah. And if you want to penetrate deep in the dermis layer, you need large spot size. If you fix short time and large spot size, which is the only solution to achieve enough fluence to induce a biological damage. Work with high quantity of watt. And how many watts we have inside of our machine? 1.8 gigawatt. The maximum is the powerest machine in the market. So it's not dangerous. It's not dangerous. Okay. These are the 3 clinical areas where we can use the Pico technology. Tattoo removal, pigmented lesion, and skin restoring. Tattoo market. For someone, tattoo is a pictorial expression. For other, is an art. For other, is a crazy moment that want to remove immediately. Doctor, remove this tattoo. I hate it. Please, remove my tattoo. The market is very interesting, especially here in Australia. We can calculate 750,000 potential treatments for every year. So a crazy market, very interesting. But with the standard technology, with the Q-switch technology, actually, to remove the 58% of the tattoo, you need more than 10 treatments. It's not my idea. You can find this data in the scientific article. And if you consider multicolor tattoos, you can remove only 12% in 10 sessions. So crazy time, crazy time. With the Picosecond technology, we can reduce this time, we can reduce the number of sessions because we are very efficacy on the small particular size. I told you that working with this technology, you are able to fragment it in very small particular size the ink of 100 nanometer of dimension. Remember, sometimes the pigment inside of the body hasn't the same dimension of the original ink that you are using, because after the introduction inside of the skin, you have a clusterization of the pigment. So sometimes you have big cluster of pigment. When you can see very dark black tattoo with a lot of pigment, in that case you have big cluster of pigment, probably more than 400 nanometer of dimension. And probably you have more than 250 milligram per square centimeter of pigment. You have a lot. In that case, probably the possibility to use the co-switch mode give us more results, more clinical results. In our machine, in Pico Discovery Pico machine, you have the possibility to switch in 3 different pulse profile. Sorry, in 4 different pulse profile, because there is also a micro pulses modality. But now we are speaking about the 2, so 3 different pulse profile. You can use double nanosecond, single nanosecond, and picosecond. So, in agree with the clinical condition of the lesion, in that case of the tattoo, you will decide to use gently, less gently, or very strong application of the energy inside of your target. Okay, you know that different color tattoo require different wavelength. Inside of Discovery Pico, we have 3 different wavelengths. We have 532, 694, and 1064. So we are able to cover all the colored tattoo. And for very critical color, like yellow or purple, we can use a protocol. For example, this is my personal protocol that I use for yellow tattoo. You can see here the yellow tattoo. I do the first pass with the fractional technology, fractional Pico technology. So I create some drilling effect inside of the skin, and in the same time I'm able to induce a fragmentation of the pigment. And after I treat the tattoo with co-switch and Pico standard mode emission. Some clinical results before and after. This is not Pico, this is normal Q-switch nanosecond emission. And you can recognize, because the whitening of the post-treatment is very high. In this case, we are using high quantity of fluence. This is the difference between the standard nanosecond Q-switch and the picosecond emission mode. Every time you use less energy, you can promote less whitening. Less fluence, less whitening, less inflammatory reaction. This is an important passage. Before and after with the standard Q-switch mode, 6 nanoseconds of emission. In this case, we have removed the fog in only 1 session. Why? Because the quantity of pigment present inside of the skin was less. Before and after. This is the same case that I showed you before, and you can see here the inflammatory reaction. Picosecond technology burn to reduce this inflammatory reaction, because sometimes after the first 2 sessions with high power, so with high fluence, with high energy, you can induce a fibrotic reaction around the remaining tattoo. And fibrosis is like a wall, very difficult to treat with the laser ray. Okay, we are arriving to the Pico technology, and this is the Pico technology. 4 sessions with 4 millimeter of spot size and 3.2 joule for square centimeter. If you consider the same quantity of joule used with the standard Q switch, we are speaking about half quantity of fluence. And this is the results. Before and after only one session. Red and black color, 532, 1064, with 2 joule for square centimeter. In 1064, in 532, we are speaking about less than 1 joule. 4 sessions, and this is the result. Okay? Before and after 3 sessions, but if you check, there is a little bit of scraping. There is a dystrophic reaction. So when you see this reaction, stop to treat, because you can create superficial scar. And 2 months after the last session, this was the result. Okay. I'm changing day by day my clinical approach, and I adjust my protocol. Now, if I use the picosecond technology in the first session, I reduce a lot the power, the fluence. See, 1 joule, and I use large spot size. This is the results after only 2 sessions working with these new protocols. Again, 6 sessions working with high fluence in picosecond technology. I have a lot of clinical cases. If you treat amatorial tattoo in only 2 sessions, sometimes only 1 session, but never more than 3 sessions, you are able to completely clean the skin of your patient. So the quantity of pigment is one of the conditions to have fast results. Pain. Why Pico technology is not so painful if you compare with co-switch technology? It's clear. We are using half quantity of fluence. So the contact on the skin, or the contact with the skin, is with half quantity of fluence. So the pain sensation, it will be less. Okay. Another application area is pigmented lesion. We have pigmented disorder because we have disorder of the E-mu keratinocyte, melanocyte, and melanosome unit. Okay. It's important to remember that we can have pigmented disorder related with a melanocyte hyperpigmentation or melanin hyperpigmentation for an increased number of melanocytes or an increased quantity of melanin. And these 2 conditions could be in the epidermis or in dermis, so superficial or in the deep dermal layer. The application will be completely different. Just to remember, epidermis melanocyte hyperpigmentation are lentigo keratosis and lentigo solaris. For epidermis melanin hyperpigmentation, we are speaking about Becker nevus, PIH, and lentigo senilis. Dermis melanocytes hyperpigmentation, Otta nevus, very common in Asiatic skin type. Dermis melanin hyperpigmentation, melasma, drug eruption, macular amyloidosis. So for these different clinical condition, we will select different protocols. Okay. I summarize in this table my protocol. For example, for epidermis melanocyte hyperpigmentation, I use 532. For the dermis melanocytes or melanin hyperpigmentation, I use 1064. This is very easy to understand. 1064 has more penetration in the skin respect 532. And inside of these 2 inside of these two components, we can use 694, for example, for epidermis and dermis melanin hyperpigmentation. Some clinical case. This is a Spilus nevus treated with 1064 and 532 because we treat in the same time the superficial and deep component. I treat an area test and you can recognize the results of the area test inside of the pigmented lesion. Okay, what is important when we are speaking about pigmented lesion? When we are speaking about the treatment of the pigmented lesion, this condition. The red is the inflammatory reaction that you induce with the laser technology. Working with Picosecond, you can reduce this inflammation because working with less fluence in contact with the skin, you are able to put under control the inflammatory process immediately after the application. And working with less inflammatory reaction, you reduce the risk of the PIH, post-inflammatory hyperpigmentation. So, check the quantity of energy that we are using with 532, less than 1 joule. Sometimes we can working with 0.4, 0.6 joule for square centimeter. And if this is important for Caucasian skin type to reduce the downtime of the patient, for Asiatic skin type is the best condition to avoid the PIH, the post-inflammatory hyperpigmentation. So for Caucasian, it's important to reduce downtime. For Asiatic skin type, it's important to avoid the side effect, an important side effect. Okay, before and after, this is a case of my colleague Sbano. This is my clinical case to demonstrate the inflammatory process working with the picosecond technology, but 0.8. Now I reduce a lot. I start to work with 0.4, 0.5 joule for square centimeter in 532. This is an interesting case because we decide to treat Becker nevus working with the two wavelength, 1064 and 532, to have an interaction with the different component, the superficial and deep component. See the crust that we are able to create for a complete denaturation of the epidermis layer, working with the 532. Ota nevus. So one tail is not an ota nevus, so just for a few seconds I remove this black cycle and you can see the pigmented sclera of the eye. So this is ota nevus. Before and after, 3 treatments working with 3.2 joule for square centimeter in 1064. If you check the literature, you can see that ota nevus was treated with 12 joule for square centimeter with the standard Q switch. So we are working with 3 times less fluence. And in Asiatic skin types, this is an important discriminant to avoid any risk of PIH, of hyperpigmentation. Again, an ota nevus before and after an Indian guy. This is a lentigo with 532, 0.6 joule for square centimeter, only 1 treatment, and no side effect, no hyperpigmentation. This is a case from Japan, from Professor Kinugasa. He present this clinical case before and after, working with large spot size and very low fluence. Another interesting case is this from Singapore. Kevin Chan showed me this incredible case, an hyperpigmentation and PIH after an IPL treatment. The doctor used an IPL to treat the lentigo, and this was the result. So he decided to treat with very low fluence in 532 and large, very large spot size, the PIA. This is a very critical case because it's not easy to treat an hyperpigmentation post-inflammatory in Asiatic skin type. And this is the results after only one treatment. This is incredible. This is incredible. Okay, again, another patient treated melasma. Melasma is fantastic. Why is fantastic? Because melasma is a very complicated pathology. Is a we can define like a biochemical chain on events. There is not only pigment. There is a lot of component in melasma. There is an alteration of the epidermical membrane, epidermical dermis membrane. There is an increase of the vascularization. There is an increase of the number of the mast cells. Again, there is a lot of clinical condition. So to care melasma, to clean melasma, probably we must have an interaction with all these moments, not only with pigment, but also with vascular, with mast cells, with the alteration of the epidermis-dermis membrane or junction. So this is my protocol for melasma. I start with the first pass, working with microsecond emission, because the machine, I told you, give you the possibility to work with 4 different pulse profile and pulse emission: microsecond, nanosecond, double nanosecond, and picosecond. So first passage with microsecond, second passage with fractional 1064 picosecond emission, third passage with nanosecond to have an interaction with the mast cell, and the last one, only the last one, picosecond emission to have an interaction with the pigment. Working in this mode, we achieve an incredible clinical result. See, before and after, only one treatment, melasma. See, I have a lot of clinical cases of melasma. This is interesting. Why? The patient arrived to the control, to the follow-up, after 3 months, but with tanning skin. And this means that also after sun exposure, the melasma didn't come back. And this is important. So probably working in the right mode, we are able not only to clean, but also to care melasma. Huh? Okay. The last application of the same machine, there is a lot of other application. I don't want to speak about nail infection and blah, 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 because the possibility to work with different emission modality give us the possibility to use the machine for a lot of different pathology. But another important application is skin restoring. We have inside of the machine the possibility to use a particular protocol, picosecond protocol, with a fractional end pieces, is focused fractional end pieces. So what this means, that you can achieve very high quantity of energy, better of fluence, in very small spot size. And what this means, every time you concentrate so high quantity of fluence in so short pass duration, you are able to induce a pure photoacoustical effect, color blended. The end pieces is able to focalize 2 millimeters deep in the dermis, the photoacoustical effect. You can see here the lobe. And this is the results that we can achieve working with this technology before and after only one treatment. Working with the Tank 64 and 0.3 gel, nothing, 0.3 gel, you can remove the global restoring of the skin of your patient. You can carry the chrono and photo aging in the same time. Okay, before and after. Check the new wrinkle condition. Before and after, only one session. In this case, 1064, 0.3 joule per square centimeter. I don't have a lot of experience with 532 in fractional mode. I start to use it, but I'm not sure to suggest to use this particular wavelength in the Asiatic skin type. Okay, which is the mechanism of action? We discovered that working with so-called ablative effect, so photoacoustical effect, you are able to stretch the whole collagen fiber, and the new tropocollagen pieces are able to stimulate the fibroblasts to produce new, not only collagen, because it's not a good idea to have a lot of collagen inside of the skin. Scars are characterized with a lot of collagen. But working with this system, you are able to induce new glycosaminoglycan production. You are able to induce new elastin production. And this is the incredible story that gives us the possibility to remodeling the scar. Like in this case, this is a scar after CO2 treatment of xanthelasma. There is an hypertrophy scar. After 3 months and January, March, 2 months, and only one treatment of picosecond fractional technology, this was the results. But check, this is the results after 3 months, and this is the results 1 year after and only one treatment. The remodeling of the pathological tissue was in progress after only one session of laser. Okay, before, after 2 months, after 3 months, after 1 year. Okay, the reason of my choice, why I decide to start to work with this technology and go around of the world to speak about this technology. Essential for these 4 reasons. Because I have inside of the machine 4 different emission modes. And so I can use this technology for a lot of different treatment, not only tattoo. Yes, tattoo is a big market, but not only tattoo. Pigmented lesion, all pigmented lesion, superficial, deep pigmented lesion, melasma, and also for a lot of different pathological disease, like one, I remember the funginous infection, nail. Less fluence compared with the cold switch, and less fluence means less inflammatory reaction. For tattoo means less fibrotic reaction. For pigmented lesion means less risk of PIH. And the last, but probably the most important, so high quantity of fluence, 1.8 giga, gives me the possibility to create the best pulse profile working with large spot size. So great penetration and enough fluence to achieve a biological damage in the deep dermis layer. I want to close with this story. This is my son with a big tattoo on the base of the neck with mom and dad. And I decided to remove it, but only mom. This is a fake story, but it's the only fake story in my presentation. Thank you.